private, you can tell us, and we will not record it on YouTube.
Okay.
Are you good with
I don't
that?
think I don't think there would be any conversation that would be private unless I was talking about somebody specifically,
Okay.
which I
Okay,
wouldn't
good.
do. But
Okay, good.
yeah.
Just wanted to let you know.
Yeah.
Okay. All right. So we give it a few more minutes. It's now another 5 minutes that we can begin, and the men will come in.
I'm gonna step away for a quick second.
That's fine. That's fine.
So when were you at Andrews? Was both of y'all were from Andrews?
Yes.
Ah,
I
okay.
I was there in 890.
Okay.
Yeah.
Yeah, that's a long time ago.
Yeah. I got my master's from there in administration. And I did nursing and healthcare administration.
Okay. Yeah. Yeah, my sister did nursing, but way back again. She graduated before I did, the year before. She graduated in 78. Yeah. Eddie Goodman, you know Eddie Goodman, who's on the chat here with us sometimes.
Yeah, that name sounds familiar.
Yeah.
I think I know. He's a
physical
chef.
therapist. Yeah. He's in Huntsville. And he was actually there at the time I was there. We didn't know each other. He was there for 1 year. And then he left. We went and we looked up the cast and we found him.
The good old cast. You can always nail people on the cast.
Yeah, my wife saved those. She saved those.
Yep, we save them too.
Very interesting. Andrews.
So where's the gentleman from that's up top? Friends talking.
He's in Jamaica. He's in Jamaica. That's our technical guy, Roland.
Ah, awesome.
He deals with all our technicalities. He's in Jamaica, Kingston, Jamaica.
Awesome. We appreciate what he does.
Yes.
From Kingston, Jamaica.
Kingston, Jamaica, man.
Yes. I was in Ocho Rios right before Christmas.
Oh, really?
Yep. I went to a destination wedding.
You went to my country and you didn't tell me?
Hey.
You know, you have to get permission to enter, you know.
They let me in. I guess
Dan didn't check in. Dan didn't check in when he came.
Can you imagine that?
You gotta check in, man.
Yeah, I loved it.
You have to get permission to enter, you know. They let me. All right. In another 3 minutes, we begin with whoever we have, and they will come in.
They're coming in. Yeah. Carrington is preaching somewhere else, and Raymond is probably busy at the church. He'll probably come in later.
Yeah. So we've had a dilemma, Dr. Parks, in that during the pandemic, we usually start at 1:30. But then when church started reopening, and the men started going back to church, we have found that the numbers have fallen in terms of attendance because the timing and their whole activities at church.
And no one wants to be in the doghouse with their wives.
Yes, exactly. But if we go any later, it's gonna be a problem. If we go any earlier, it's gonna be a problem. So we just say, okay, we just stick to 2:00, 2:30, and whoever comes on, comes on. So that has been our situation.
Yeah.
So where are you located, Dr. Parks?
I am in Georgia.
Okay.
In the U.S., not the one over there in Russia somewhere.
Well, put it this way: you would have had to be almost bedtime or sleeping by now.
Right. I was about to, but I was like, wait a minute, this thing going on today, and I know I have someone coming over, so I'll have to step away to let them in.
Okay.
And then I'll be back.
Okay, that's fine. But then you remember that you were on the duress by your friend, so you had to be here at 2:30, yeah?
And I was here at like 5 to 2. Been sitting here waiting.
Yes. All right, we'll start in another minute and we'll just get going. So, Dan, what I'm going to do, I'm going to turn over to you and you just take over and
Okay.
lead everything. It's all in your court. So you can start at 2:45, Dan.
Okay.
But first of all, I will do a welcome and then turn over to you, all right?
Excellent. I will follow your lead.
Okay. Okay, good afternoon, everyone, and welcome to another edition of Friends Talking. Today we have the distinct privilege of having Dr. Parks, who we will hear more about in a bit. And we also have our host today, Elder Dan Smith. Dan, welcome to Friends Talking. Dr. Parks, welcome to Friends Talking. And at this time, I will turn over to Dan, who will take us through the evening's conversation.
Hello, everyone in Friends Talking Land. I'm Elder Dan Smith, and it's a pleasure to be here with you all. We're going to be delving into some issues that affect men on very different levels, on a psychosocial level, if I can say that, as well as personal, that affects how we deal with people in our everyday lives. So at this time, I'd like to open up with prayer. Dear kind Heavenly Father, we thank you for the many blessings you've given us on this day, this Sabbath day. We pray that you'll open our minds and our hearts, that we shall receive a blessing or a special insight on how we function, how we can function better with a therapist and Jesus. This is my prayer. I do ask in thy Son, Jesus Christ's name, Lord, and for his sake, amen. Well, it's a pleasure again, joined here by Dr. Terry Parks. We've known each other for many moons and years. He is a licensed clinical psychotherapist and the executive director of A New Approach Behavioral Health. How you doing, Terry? How you doing, Dr. Parks?
I'm great. Thanks for having me.
Yeah, so can you tell me a little bit more about A New Approach Behavioral Therapy?
Well, A New Approach Behavioral Therapy started off, over 15 years ago. And I started with actually doing domestic violence classes for the state. And then I began doing therapy and counseling, later on doing the program, and psychological for folks who are having bariatric surgery, court-appointed domestic violence, anger management folks. Sometimes the court will ask for a psychological for people who have gotten into family violence situations, and they'll just order us a battery of, alcohol and drug evaluation, a psychological for that, and a psychological for bariatric, and a psychological just because the judge was like, whoa, this person kind of went off the chain here, are two different things. So I do like two different, psychologicals, and we see folks from, we were seeing kids before COVID, but it's hard for little kids to stay in tune when we do it this way. So we just kind of like brought it up to teenagers, more so 16, 17. But I'm so booked now, I just can't even, I can't even because COVID did have a lot to do with folks becoming depressed and suicidal, and I was already busy, but with that, it just kind of just blew up. So yeah, we are in 5 different counties, or I believe across Metro Atlanta, and we're always open.
And I thought it was interesting that you're talking about COVID, and during the COVID crisis, is not over yet, but during the height of the COVID crisis, your office, your practice was also opened up to take more clients across the state. You had was taking clients from all over the United States because it was such an increase in high need for therapists. Am I right?
Yeah, that's correct. We were allowed to go. It's kind of what they're working on now, which is called, I think, an interstate compact, where we
and
can
that was
work,
virtual,
right? Where we can
Okay.
work with other states without having to go through, licensing again. Because if you're in one state and you're licensed and you don't have anything on your license, or, where there were some ethical concerns or whatever, you should be able to just go into the other state, just know their laws and things like that, and you should be okay.
So tell me this. Do you think that there's a difference in getting therapy being online in person than it is in person?
Well,
is
a
there
lot
the
of
same
people,
outcome?
well, it depends on who it is, and it depends on who the therapist is. Okay, some people like coming in. They want to sit on the couch or sit in a chair. They want to see, the therapist and be right in the room with them. Okay. I think COVID or telemental health is what we call it, doing it online. I think it really, really works for people who are having bariatric surgery, because they may be
bariatric surgery is
people who are having surgery for weight loss.
Okay.
So there's like the sleeve, there's the gastric bypass and different things like that people do. I think it works best for them because they may be a little bit embarrassed to come in, and there may be some, body dysmorphia, just different things like that. They're embarrassed of their size, so it's easier this way. But for most therapy people, a lot of times they want to be in the room with you. I don't know, maybe they feel there's some special healing power with being in the room, but it's going to be pretty much the same. So, yeah.
Well, it's interesting. It was an increase because people were, I don't want to say locked up, but they were in lockdown,
right?
In their own silos, and people got depressed. People got, the love of their lives turned out to be the nightmare of their lives. They were like, it was like, oh, I thought I could handle this. I thought if I had someone with me that I could handle these problems with COVID lockdown better. But it seemed like mental health therapy increased, the need increased during COVID.
Yeah. For the most part, it did, because people had cabin fever. People had, people were going stir crazy because you couldn't leave. You could risk your life, but you couldn't leave. So now this person that you took vows with, you guys are there all day, every day, seeing each other. And if they're kids, they're running all over the place, and you're like, oh man, I just got to get out. So actually getting out and going to work and leaving the house was actually better than, because everybody says, oh my God, I'd love to work from home. I'd love to work from home. And then they work from home and they realize, I don't like it. Now, maybe that has something to do psychologically with being what? Conditioned that way. See what I'm saying? That's what everybody gets out of the house and goes to work. Everybody goes to work. Everybody goes to work. Nobody stays home. Well, what if you were conditioned and every time you work, you stayed at home? You probably have a problem with going out. So, it did play the closeness, which you would think would be a good thing, turned out to be not such a good thing for some people.
For all of you all who are just joining, I'm hosting today. Thank you, Marcel, on Friends Talking. And I'm interviewing and talking with Dr. Terry Parks. He's a licensed clinical psychotherapist, executive director of a New Approach Behavioral Health. So we're just talking about what people have been going through during lockdown. We're building up to the subject matter, and you are a Christian therapist, but you're a Christian first, but that's a good way to say it. And we are building up to what we're talking about is this term, and I'm going to break it down from the macro to a micro approach. So the term that's on the table today is dysphoria. It sounds like a new movie coming to a theater near you, dysphoria. So dysphoria, if you can let me know what dysphoria is in the short term, then we'll break it down.
In a short term, let's see, being, uneasy, dissatisfied, unhappy with, the current state of affairs or whatever you have going on. So that's it. In a short and sweet.
I like it. I love it. I love it. In taking that into account, it seems like our okay, I'll phrase it like this. Dysphoria, those conditions can occur across the board, right? When I say across the board, with anyone.
Absolutely. Mm-hmm.
Okay, then from that point, it can be even magnified with men because of the expectations.
Okay.
I'm driving somewhere. Stay in the car with me.
Yeah.
Stay in the car with me. Okay.
I have my head out the window. Okay. Let me come back in. Okay.
And to top that off, maybe it's even more magnified when you're a minority, which most of us here are.
Okay.
Now,
go ahead.
Does one have to do with the other, so to say?
When you say, does one have to do with the other?
Yes, the other of dysphoria, does being a male minority, I'm all encapsulating it now, because this is all of us here. And it doesn't, like we just established the fact that it can be across the board. So it doesn't matter if you're in Jamaica, it doesn't matter if you're in London, doesn't matter if you're right here in sunny old Florida. You can still experience and have these feelings of dysphoric feelings, meaning stress, distress, because of the things that are the high expectations of men. Or even the views and opinions that don't matter on this channel. No, but the views and opinion that can affect us as minorities and as Christian men. It seems like there's a lot of expectations and pressure that could cause this dysphoric state.
Yeah, I mean, anything can cause it. Location can cause it. Current, climate. When you look at what is it? Seattle. Seattle has more what? Seattle has more suicides than any other place. Why? Because it's always raining and glooming there. So yeah, it can happen. I believe there's
wait. Take note of that again. We're gonna put a pause on that. So Seattle up north on this other coast, which is kind of cold and gloomy. Say that again.
A lot of people have seasonal depression, like they have seasonal allergies, okay? And so they get kind of depressed and down when the seasons change. Now, there's a lot of rain in Seattle. And so that causes a lot of people to be depressed all the time. So your suicide numbers are going to be higher there than anywhere. When we look at careers, this was a study done years ago. I remember reading this years ago that dentists commit more suicides than any other profession. And I was like, wow, what's the issue with that? And it's because they cause a lot of pain.
Oh my goodness.
They cause a lot of pain.
And that's not a joke.
They cause a lot of pain. And so it kind of gets to them that they're causing pain. And so, yeah, that was a study years ago. I was like, wow, I'd never heard that before. I can't remember where I come across that. So yeah, it can, dysphoric behavior, can be attributed to anything. It could do, like I said, where you're located, who you're married to, an illness, the current state of affairs, your employer, the career you chose. Anything can, can contribute to that.
That is so interesting. And this dysphoric behavior is kind of a chess where you just dump all these type of behaviors they call it dysphoria.
Mm-hmm.
Now, the thing is to recognize, how can someone recognize if they're going through dysphoric behaviors or stress? Because lots of times us men like to mask and
Mm-hmm.
not admit,
Mm-hmm.
because that's the way we were brought up. And there again, I'm talking about the macro picture, because this happens no matter where you are. This happens as, hey, we are who we are then. And it can, how do we recognize, how can we recognize that this behavior is taking place in ourselves?
Well, that's a good question. And what you have to realize is a lot of times we mask certain behaviors because that's the way we have been conditioned. Okay. We have always been a group of people who have always had to suppress a lot of our feelings and emotions. And so how would you recognize it? Well, most men, we do what? Well, this is what I got to do. I got to preach. So I got to push on. So how do you recognize this? You know when you're not feeling good. You know when a cold is about to come on. The problem is being able to say, hey, I need help. Hey, I need to talk to somebody. But a lot of times that's seen as a sign of weakness when you reach out for help. And I got to be strong. And I got to, because I'm a man, or I got to be strong, for my family. So I can't let them see me be weak, and I can't cry. And if you grow up in a home where, masculinity was the order of the day, which I don't have a problem with, but let's just switch that to a single parent home where there's no man and mom is trying to raise a son. And so she's trying to teach him to be a man. And she may say things like, well, you have to be the man of the house. You have to be my big boy. Big boys don't cry. So we suppress our emotions. And then those things get reinforced by who? Our peer group, our coaches, football, basketball, even our family members. So being able to recognize, you have to check in. We as men have to check in with each other, because we will probably recognize it before the person experiencing it. And you say, hey, Dan, you all right? I just noticed you kind of been, off your game for, let me check in. Let me see, is everything all right with you? And so we have to check in with each other and help each other out, because other folks will probably notice it before we do. And if you just seem like, man, I can't make it work for me. Things just keep, things just, keep happening to me, whatever the case may be, that's negative, then that's a sign. If you're stressed out, if you go get a physical and a doctor say, hey, look, your numbers are off here. We need to get this under control. You're stressed out, you're having, mild heart attack or whatever. You may have a stroke. It's like, hey, it's time to slow down, get checked out, and a lot of people will say, just pray about it. I have no problem with that. However, praying about it and actually doing something about it, two different things.
Faith without works.
Yeah, faith without works is dead. So you can believe all day long, but unless you put it into practice, then it's just sitting there. So yeah, I need help. Let me get a therapist. Let me seek out someone, and let me go to someone who is actually qualified. Now, let me say this. I don't know if some people are going to get mad or whatever, but just listen to what I have to say. And this is not all, but most people will go to see their pastor. Okay. And that's okay. Because a lot of times your pastor can help you with your spiritual walk, but they are not well versed in things like domestic violence, therapy, counseling, or whatever. So they tend to, not all, some pastors will practice outside of their documentable competencies.
Say that again.
They practice outside of their documentable competencies, meaning you can't document that you are competent in this area. As you mentioned before, I'm kind of like an expert in domestic violence. A lot of women will go see the pastor. They've told me this, and I say to them, you sure you want to go see him? You know, because I'm offering different things. Well, I think I'm going to go see the pastor. Okay, so you know he's not well versed in that area, right? Okay, well, if you need, here are some other resources. But people cling to that. They go see the pastor, and they end out coming, you know, they come out of the session more angrier than they were going in, because the pastor is coming from a book that's that's mainly what? Patriarchal. And so when the woman goes in, all she's hearing is submit, 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 submit. And so she comes out and is like, wow, but he's putting his hand on me. He's doing this, he's doing that. You gotta submit, you gotta submit. And so, yeah, and so you actually, a pastor may make the situation worse. I'm not saying don't go see your pastor. I'm saying know your pastor's strength, and a pastor has to know his strengths.
Exactly.
And play to those.
Because there are some qualified pastors.
There are some that are
Right.
qualified. And so therefore, if it could have been somebody who went and did pastoral counseling and got a license in it, okay, that's perfect. However, I think pastors want to be all things to all people. They don't want their flock to, you know, I don't want the person to seem like I'm weak or what. No, a good pastor, if he doesn't know, does what? I'm going to delegate. I'm going to say, hey, you know what? I can't help you, but I got somebody who can, you know, and then that's an appropriate way to approach it.
For those who have just joined us on Friends Talking, I'm Dan Smith, and I'm kind of hosting today. Thank you, Marcel. And we are talking with and interviewing Dr. Terry Parks, a licensed clinical psychotherapist, executive director at a New Approach Behavioral Health in the Atlanta, Georgia area. So Dr. Parks,
yes,
I hear what you're saying. I can buy that for $1, so to say, but I'm that type of individual who's older, and you know, this is kind of new to me to open up about my feelings, or even admit that I have a problem, or even admit that I am the problem. Do you think that a person, a man, strong Black man, can change his thinking? Is it in us to, after we're kind of setting our ways? I've been told I'm setting my ways. Can my mind be retrained? And how does that happen?
It actually can, because the mind, for a while, okay, it was thought that the brain stopped growing, but it doesn't. So if we have anybody on here that knows biology or an MD that studies the brain, it's called neuroplasticity. The brain keeps growing. It doesn't stop, okay? And so therefore you can retrain your brain. That's a brain right there. You know? Okay, I use that. Okay, you can, okay? And so that's usually done through, you know, first of all, the person has to want to change. Okay? They have to admit, okay, you know what? I don't want to be like this anymore. I want to, okay. And so, you know, through things like
confessing the sins,
right, you know, cognitive behavior therapy, which is all, so CBT, dialectical behavior therapy, DBT, you know, through things like that, you can rethink it. It's called, what is I can't remember the name of my book. It's written so long ago. But yeah, cognitive behavior therapy, what it does is it changes the way you see things. So, cognitive restructuring is what it's called, positive cognitive restructuring, and looking at something differently instead of looking at things in all or none, black or white, or, oh, this is it. Try to find the gray in between.
So you say, so that's not creeping compromise. That's just finding ways to retrain your brains to, because I know Scripture wants us to be enlightened. It says to study thyself to show thyself approved. Study to show thyself approved. So it's not contradicting. I don't think the word is contradicting itself when it's saying, I want you to know more so you can be a better person, to make you whole. If we're more whole, then we can add more to the kingdom. We can grow, we can enhance. So looking at something one way, and I'm just saying, in growth, in the growth factor, if we train our brains to open up, to be more Christ-like, and I guess to see, I'm not going to say see the gray, but see different shades of gray where it could bring you closer to Christ so that you can understand and pray specifically for an issue. I think that will be a better outcome for people when we're dealing with people who have different issues, different problems, because now today is not just, we say, hey, we've gotten so far away from the word, which is true. But with so many issues now, I think now we have to be more understanding and compassionate like Christ than ever before. So you talked about, I wrote some things down. We talked about dysphoria. People get depressed. How can we interact with people and our fellow man if we see these issues of depression? Should we tell that person? If we notice something, can we go to that person and say, hey, I think you should see a therapist? How do we navigate that area?
Yeah. So there's certain words that you probably shouldn't use, okay, when you're approaching someone who needs help, okay? Like you said, I think you should see a therapist. That may offend some folks. And so if you say something like, have you ever considered talking to someone, a professional, about what's going on with you? That sounds a little bit more smoother. You see what I'm saying? Because when you say you need to see somebody, you need to talk to a therapist, a lot of times people associate therapists with crazy. Okay. Now, for everybody on here, I just want you to know there is no diagnosis called crazy. All right. So therefore, you guys can stop using it. All right. There is no diagnosis called crazy. All right. But let me back up to something you said. A lot of times we see people in our church, and people join the church, who have mental health issues. And we do what? We kind of push them to the side. Nobody talks to them. People grab up their children. Nobody invites them over for, lunch after church or whatever the case may be. They're usually eating at the church when, the church serves. And so, we used to have, when I was coming up, different ministries in the church that would, not necessarily deal with, mental health. They didn't have a mental health department, but I think every church should have one. Every church should have a mental health ministry. Do not confuse this with medical. Medical gets more props than mental health does, because there's been several times they have tried to start mental health, stuff in the church, or, and it's always, us mental health people are always thrown under medical. No, that's not what we do. those two need to be separated out. You need to have a mental health ministry or whatever in your church. And then when you see that person, those people who are the mental health experts, they can tell when someone has some mental health issues or they are decompensating, you know, which basically means they're not taking their meds, you know, if they have been taking them the whole nine. Hey, you okay? Let me come by here, stand by, don't touch them because you don't know what's going on. Let me just stand by you, you know, let me sit by you and see what's going on. And that way, a lot more people would get help. But we kind of push those people under the rug and we, you know, push them away because they're like, oh, I don't want to be bothered with that. I can't be bothered. I don't know how to deal with it. That's the issue. I don't know what to say. It's kind of like when someone dies, people don't know what to say. So they say inappropriate things and it makes the situation worse. I know how you feel. They're in a better place right now. They up there with God and his angels. And they say all kind of stuff. And they're just like, I'm not trying to hear that right now. So when someone dies, it's like, I'm just going to sit with this person. I'm going to just sit right. You know, how was it? Job boys just came and sat with him. It's like, man, we don't know what to do. So we just going to sit there with you, you know. And that's kind of what we need to do. We need to be more active in mental health in our church. It needs to be, you know, we will talk about diet till we blue in the face. We'll talk about, you know, medical till we blue in the face. But when we talk about mental health, and there's so many mental health people in the church, when we started doing something, I'm like, I didn't even know all these people were in mental health. You have psych nurses, you have psychologists, you have psychiatrists, you have social workers, you have marriage and family therapists, all of these people in the church, and you don't even utilize.
Mercy. You know, what you're saying is so true. I just can recall about maybe 5 incidences that happened at our church. And who did they call? They called the deacons. Then they called the cops. You know, and so the church is just wasn't equipped. And it wasn't that long ago. So, you know, we can't say that, well, you know, maybe we've adjusted to the times, but having a mental health ministry, I like that. A mental health ministry is needed. It is really needed. And that's something that we need to, that's right. Because just because you're a nurse, that doesn't mean you're going to know how to handle, or even if you're a doctor in orthopedic surgery, you don't know how to deal with a mental issue.
So, I think there was
a
time when we had an incident at our church during tithe and offering. There was an incident, and I was out there. I was on the safety. I was safety at the time, safety director or safety something. I don't think I was at that time. I don't think I was. I think either I was or somebody else had taken the position. And so they called, and of course, you know, you have some guys who are packing in, guys who used to be ex-cops and this and that. So they come in, and we're live. We're live on, you know, camera,
streaming live,
and they came in, and everybody started grabbing, you know, this individual. Everybody started grabbing this individual, and I went and sat down. And so my wife asked me what, you know, had happened, and I was like, you know, he may have had a psychotic break or something, I'm not sure. And then she said, you should probably go and see what's going on. And I went in the back, and because he was a deacon and everybody knew him, they were just, you know, just going in, and cops were standing around, you know, and I'm talking cops, guns, they didn't have them drawn, but they were standing there, whatever. And, you know, and I sat there and I said, okay. So I told the head guy, I said, everybody needs to leave. Ask your officers to leave. I said, because these guns are intimidating. They're there, they have their arms folded, you know, and I said, so he said, okay, everybody out. And so got a few people out, and I started in with him, and I said, hey, after he was telling the story, I said, listen, I said, man, I said, I get it. It was a program that he wasn't, he didn't felt that the Lord had blessed or whatever the case may be. And I said, I get it. I said, I don't too much care for it either. I said, however, we want everyone to enjoy the worship experience. And I said, but doing this, I said, this is not going to work, because when you do this, everyone is going to see. We have the kids singing, they don't know what's going on, and people start putting their hands on you, taking you to the ground or whatever. And I'm just like, how are you feeling now? Are you okay? Is everything here? Are you taking medication? Do you need to? No, I'm not on any medication. And I talked to him and I validated him.
Mm-hmm.
And through that, that's a key word, I validated him, but I didn't validate the behavior. I validated his what? His feelings about what was going on. After that, he shook my hand. The head guy was like, you know what? I need to come sit on your couch. And after that, that opened the door for me training the safety committee. I was training the safety committee at church.
So you've identified the need, and we definitely put your questions in the chat. We are going to open it up to the floor with questions as well. But you saw a need that a different approach, as your name of your business is, to mental health, mental therapy, and that was not grabbing the person, because the incident that happened at our church, yes, a big strong deacon grabbed him and put him in the lock, and he couldn't get out, and then it just made it. I would say it made it worse. It did stop things, but what we found out that person missed his medication.
Yeah,
so,
and see, here's the thing too. let me say this real quick. What you got to take into consideration is we don't know, are these people, do they carry a diagnosis? So let's just say this individual was schizophrenic, okay, and he hadn't taken his medication. So instead of coming at, let's say it's a one-on-one thing, and I'm coming at a schizophrenic person with my hands up like this to put my hands on them. A schizophrenic person is not going to see two hands. They're going to see what? Many hands. You see what I'm saying? And it's going to be like, oh, all of these people, they're trying to grab it. And it's only one person. So you got to be careful not to touch people when they are in this state.
This manic state. And wow. And the need that I identified that you saw and implemented was the need for training. Now, there's a lot of our churches may not have mental health ministry, but they can find a mental health therapist to train maybe people in the health department and recruit some of those social workers and psychotherapists and therapists, so that they can be trained into what you do, because we have now training of active shooters now in church. What will happen if there's a shooter and things like that? But I think addressing the behavior, it's like the red flag laws that that's people are starting to take up throughout the United States. The red flag laws, mental health, if they've had some issues in their past with mental health, that's a red flag. So we're not going to give them a gun. But if they're implementing some training in the health department, I think that will go a long way in our churches. And instead of calling Deacon Carter and letting him put his hands on them, and then it gets worse, and then they're talking about, did you know what happened with so and so? So training, I really like that training and identifying. And I think we can take that back to our pastors, to our places of worship. Hey, could we implement or have somebody come in to do a training session? So if the issue, because the issue will happen. If it's happened one time, it will happen again, guaranteed. Right. Because the way the church is made up, you're going to have a lot of different peoples of different backgrounds. So we just have to understand and deal with that. So
So let me say this right quick too. It's something
Mhm.
important you said. You know, it could be a small church where there is no one in the church who is in mental health. Okay. However, like you said, they can go to the local community, service board, or go to, the clinic and say, hey, we'd really like somebody to come into our church and talk to us about mental health and the signs. And you'll be surprised that they will come over there and they would talk to you about, how to recognize signs, or, whatever the case may be. So there's always some help out there.
And you've gone around to different churches and put on seminars and things like that regarding domestic violence, other issues. So we can also contact you. So
I know somebody's had their hand up here, for a while.
Oh, really?
Friends talking.
I
couldn't see it because it was brown. usually it's yellow. And so I'm like, wait a minute, somebody's saying. Okay.
Doctor, you're having jokes, aren't you?
Marcel, did you see the hand? I don't see the hand.
It was my hand. It's my hand. It's up in the far left-hand corner.
Yeah, it's up in the corner.
Okay.
Yeah.
Oh, okay. There it is.
I couldn't see it because normally the hand is yellow, and I'm just like, oh, I didn't even recognize that. Okay,
go ahead, Marcel.
Okay. Well, Doctor, I mean, I've been enjoying your presentation so far, and I just want to go back a bit to when you spoke earlier about the perception of psychiatrists, psychologists, and men. We have grown up in a society where, and the word in the US part of jargon is shrink. To go to see a shrink is considered to be taboo. It's a sign of weakness, as you mentioned earlier, and it's a sign of weakness to our wives, to our children, to our community. That, hey, here is Marcel going to see a shrink, and Marcel is having all these issues. And so, because of our pride and because of our socialization, we would neglect taking up that responsibility to go and see this professional and go through our circumstances by ourselves, trying to deal with the issues. So that's one point. And I'm also wondering. You mentioned about the pastors and the church getting involved, and I'm wondering if there is an awareness of the need. I mean, certainly, mental health, the reality of mental health has just come to the fore in the last 3 to 4 years, what with the pandemic, as you mentioned earlier. It was there before, but we never paid attention to it. In my culture, when we saw somebody who we thought was mad, they were just placed to the corner, as you said, and nothing was done to help them. And so I'm wondering if it is certainly becoming more aware, more awareness is coming to the attention of everyone. But I'm also wondering if our pastors they may not be the most suited profession to take on those sort of responsibilities. A few weeks ago, we had Chaplain Dorset, who is a trained mental health professional who was able to deal with those situations, being a mental health professional in the VA and also a pastor, a chaplain. And so he was able to ameliorate the two professions together seamlessly almost. And so you also mentioned, I'm just throwing this one in, you also mentioned about at the church level getting these professionals in. I'm wondering what with the level of investment that is required, and maybe I'm asking a totally ignorant question. Would it be more appropriate to focus the attention on a conference level? I mean, with all this politics, and work it down to the church levels. I mean, we can talk about that.
Okay, so let's look at that. Okay, years ago, the conference came out with this program called End It Now. Okay, for domestic violence. The program called End It Now. That program came out, and they were going out to the churches to talk to the churches about domestic violence.
Domestic violence. I remember that.
Okay, End It Now campaign. And so I said, man, this is what I do. I call the conference. It took me forever to get in contact with someone in that department. When I did, I gave them my name. I told them what I did. I gave them my website, the whole nine. They sent me material. Okay. They sent me material. And some churches had it, some churches did not. I left it with some churches. Okay. It was a big drive, and then it kind of died. And so when I was calling and trying to, be a part of it, I never could. But when there was something big, they would call certain people who would speak. And I would sit back and I was like, I gave these people my information and my number a while ago. Not sure why they didn't call me, because the person they have up here talking about this really doesn't know about domestic violence.
Yeah, they had a nurse at our church talk about domestic violence, and she was presenting it. It was a good program, but to your point, they didn't have the professionals or the professional of domestic violence presenting that program. So yeah, they're, like Marcel was saying, there may be politics involved, overtly or covertly,
especially with domestic violence.
Right.
Okay. But when you're talking about mental health, do we take it to a conference level? Who's going to drive it?
Exactly.
What I find is that I think we're only concerned about the issues that affect us all. Mental health affects us all. Domestic violence affects us all. However, it affects us at certain levels, and a lot of us don't care about what happens. It's like, okay, well, that really doesn't bother me. I don't want to, deal. However, if something happens in the church to that person directly, here's a better example. You're going about your life, you're not worried about anything, and you have a kid, and they say your kid is autistic. Now that person does what? They do a lot of things, and they join groups that have to deal with autism and the whole nine. You have a child gets hit by a drunk driver. I'm joining MAD. I'm joining SAD. I'm joining all these different programs. And so a lot of times, unless it affects us directly, we don't necessarily get involved.
That's right.
How would the church, how is the church gonna handle it? It has to be a community of people who say, hey, we're going to take this seriously in our church. Our ministries need to take it as serious as you take what? Pathfinder, Sabbath school, whatever the case may be. Take it that serious. Go ahead.
That's why I believe,
Amen.
That's because we talked about the macro. Now I think we're coming down to the micro. And I think the mental health ministries, as you said, I think that's a micro issue that we need to take responsibility for ourselves, of the churches we go to implement or try to put something, at least awareness, to the forefront, because it happens on a micro level. It happens at our church. It happens in our community. So if we wait for the conference, we would still be waiting on the conference. I say, do not wait for the conference. I'm glad at my church, our pastor, really, he likes to empower us. He says, whatever ministry that you have this passion for, and you see a need, if it can fulfill a need, then you go ahead and implement it. So there's been new ministries at my church that's been implemented. So this mental health ministry, that, to me, I think that is a micro issue that we need to address at each one of our churches. And don't wait for the conference. Don't wait for the union or the local conferences. So I'm going to start opening it up now for some questions, because it seems like there are people they want to jump in like double Dutch. So I think Lynn, what was it, you or I'm not sure. Just let's go.
Well, Dan, there's some questions in the chat. I don't know if you want to address those questions in the chat.
Well, whoever have the question, come with your question. You can raise your hand and we can go ahead with it.
All right, Dr. Hugh. Doctor, I'm going to invite Dr. Hugh to comment here because he has some comments in the chat. And also for full disclosure, you mentioned earlier about dentists, the highest rate of suicide in dentists, and Dr. Hugh is a dentist. So I'll ask him to comment on that and also to bring forward his question that he has in the chat. Hugh?
Hugh once. Hugh twice.
Okay, he's coming on. Yes.
Okay.
Yes, go ahead, Hugh.
I don't even know what the question. Okay, hold on, brother. No, mental health issues. It's such a taboo thing.
Yes.
And in our church we have like 6, and I made a comment is like, and I guess I can ask the doc to go, doc, do you have patients in your congregation who you would see as who you see? Because it's such a people are so concerned about privacy.
Okay, so two things. Number one, to answer the question, it's limited, but I do. The issue there is, and I was reading your chat where you talk about confidentiality. So let me say this. Years ago, there was this doctor that was at one of our hospitals, and he was a white doctor, and we were friends, and he came to me and he said, you know, man, your practice ought to be booming. I'm like, what are you talking about? He's like, I see so many of the folks from your church. I'm like, really? Huh? Wow. No, I don't see anyone from my church. Okay. And I think what people don't understand is they feel that the other man is more either not going to talk about their issues or is well versed than you are. And what they don't understand is we're bound by confidentiality. So it doesn't matter who you are. There have been people who come to me and talk about issues, and I'm not even in a therapeutic relationship with them. And I don't say anything. I don't say anything to anybody. You know, it's not my place to say. They didn't tell me, don't tell anybody. They didn't tell me, you know, hey, it's okay. You know, keep this to, I just don't talk about it. I don't talk about it because that's not my place. And what we have to do is we have to, you know, urge our people to feel comfortable in coming. They don't know. I'm bound by confidentiality, and I don't think I want to lose my license talking about your issues. Doesn't benefit me at all.
I'd probably draw an analogy. It's like, I see you, I know you, I like you, but I don't want you to see me naked.
Yeah. And some people, you know, can do that, but it's like, hey, you know, in cases, if it's something like that, I will refer out. I will refer to someone else. It's like, hey, you know what? This person is good. Let me help, you know, because you might, I give an example. There was someone who was referred to me for bariatric surgery who I knew, you know, and was a church member. So before I did anything, I called them and I said, hey, I got your paperwork here. I said, I'm just calling to let you know. And they didn't even know what I did. And I said, now, I can refer you to someone else, you know, if you don't feel comfortable. And then they were like, oh my God, no, I'm glad that it's you. That's what they said. I'm glad that it's you because I feel more safe with you. Trust you. I went ahead and saw the person, did their report, and the rest is history.
Good stuff. Good stuff.
Yeah.
Good stuff.
So they have to feel comfortable with you. See, they'll go to when it comes to mental health, I don't want to see anybody, but they will go to people in the church for medical, dental, vision, you know, all of that. but they won't go, for mental health. I find it fascinating, but I get it.
Hey, we know us good Adventists, and we like to talk. Hey, did you hear about so and so? That at least that's what they're thinking.
Yeah.
They don't want to be at the potluck discussion as being the topic.
Yeah. And sometimes, not all, and I don't want people to think I'm ragging on pastors, but pastors got to understand confidentiality. You may go see a pastor and find yourself in a sermon. It's like, wait a minute, he's talking about me. That's stuff, and you got to be careful. You got to be careful with that. So, yeah.
Another question. I think when I heard you use the word crazy earlier, so there's no such thing.
Mm-hmm.
I think a lot of times when we talk about mental health, we concerned about things like schizophrenia or bipolar disorder, and some of the other things like PTSD that people are dealing with, some narcissistic issues. We kind of downplay those things. I don't know if you want to speak to that, because a lot of people should.
Yeah, we do.
I think most of us could actually be on DSM scale.
Dr.
I think
Terry,
most of us could actually be on the DSM scale, but we just not diagnosed.
Dr. Parks, he hit on something that is a big problem to me in our society today, maybe in our church. When he mentioned narcissists, it's a lot of narcissists that don't know that they're narcissists. Can you kind of identify like a narcissistic behavior?
Okay, so let me ask you this. All right. Since Hugh brought it up, Hugh, what do you think a narcissist is? Describe what you think a narcissist.
Generally, somebody who's completely self-absorbed. I mean, and self above everything else.
Okay.
In one word,
And
Donald Trump.
somebody else was talking. I'm sorry.
Well, he just said Donald Trump.
Donald Trump. Okay. Dan, you got an example of narcissist? What you think a narcissist is?
I like a clinical definition. I have something in my head, but
just tell me what's in your head. What do you just off the rip?
Satan. I. Everything I did this.
So it's all about them.
Exactly, and they draw everybody have to build that person up too. It's like they come to the point where everything has to be self-glorification.
Okay, so here, let me help you guys out, because everybody says, oh, narcissists, they're all self-absorbed. Okay, because you said it too. Self, that's the key word. Okay, narcissists are not in love with themselves, because narcissists don't have a self. They have an image that they have created.
Oh my goodness, that's deep. You gotta repeat
now.
Hold on, you gotta rewind that, Terry. I'm sorry, sure. Dr. Parks, but you gotta say that again. I have to absorb that twice.
Narcissists are not in love with themselves because they don't have a self. They have an image. Okay? It's an unhealthy attachment to image, not to love. If you look up the Greek character Narcissus, he did what? He sat by a wading pool, saw an image that was his, and sat there until he died. They named a flower after him. Narcissus never knew that the image was what? Him. But he fell in love with it and was like, oh my God, I'm beautiful. He didn't say I, but it was like, this is a beautiful image. And he sat there. So it's an unhealthy attachment to an image, not to love. Let me take you to The Wizard of Oz. In The Wizard of Oz, after he gets discovered by Toto, what is said? Don't pay any attention to the man behind the curtain. I am the great and wonderful Oz. They have created an image. They don't want you to see behind the curtain because they have put a facade up. That's what they want you to see. Oh man, they got it going on. Look at that. They got Louis, Gucci, Ferragamo, Tory, Birch, Burberry. They just got the fanciest cars. but behind that facade, they are suffering. Here's another thing. Somebody mentioned Donald Trump. Donald Trump, stay with me now on The Wizard of Oz. There were flying monkeys in The Wizard of Oz. The flying monkeys do what? The bidding of the narcissist, sometimes taking on the narcissist's behavior and taking it to a whole nother level. Remember everybody rushing the Capitol building, taking on. Now see, Donald Trump wouldn't have ever done that, but the flying monkeys did. So remember when she said, bring me those slippers. And they did what? They went out and got them. She didn't tell them to do what? She didn't tell them to harm them. She didn't tell them to kill them. But the flying monkeys did what? They went out there, they're pulling the straw out of the straw man. They're, harassing the lion and everybody else. I didn't tell you to do that. I just said, bring me the slipper. That's what narcissist is. They are caught up in an image, not of themselves, because they do not have a self. It is an unhealthy attachment to an image.
Ooh, that's deep. Do you think a narcissist could recognize that they're a narcissist?
No. Narcissists do not change. They're like addicts. You ever see someone 30 years clean? Yeah, it's been 30 years since I've had a drink, and I'm still in recovery. Why? Because at any moment they could fall off the wagon. If you're going to try to treat narcissism, the best treatment is probably maybe rational emotive therapy. Maybe that. Not sure, but it's going to be a task. It's going to be a task.
So
now,
it sounds
there was
like
something about narcissism. I think there was something else in the question that wasn't talking about narcissism. It was something else. I don't know how we got on the narcissism.
Narcissism is very interesting because, you see that a lot in, that behavior. I'm not a clinical therapist, so I'm not going to diagnose anybody as because they're this way or that way. But it just seems like there's a lot of I in the church. There's a lot of, pecking order, so to say. And it's easy. And okay, I'll bring this back. We're talking about men. We're talking about black men. Seems like sometimes the church is the only place that they get that recognition, that authority, because they may not have it at home or on their job. How do we deal with that and reconcile that?
Well, how do you deal with it? How do you reconcile that? When you're talking about church folk, you're absolutely right. There are people who, in the church, you have your professional people, and then you have your, I don't know, what's the way to look at it? And I'm trying not to have a, speak ill or say anything or give people labels, but just for the sake of this conversation, your skilled folks and your unskilled folks. Does that make sense? And then you got people in between. So it's almost like class. You're wealthy, middle class, you're lower class. Okay. And I'm not saying that these people are lower class citizens. What I'm saying is that a lot of people, professional people in the church will throw that their weight around because they are professional, because they have degrees and they look down on everybody else who doesn't. So you have the folks who are down at the, who maybe don't have degrees or whatever, just maybe went to high school or whatever the case may be, maybe a little community college or something. They're fighting for position. And so you have these two, folks going at it, and they figure because I was voted in this position and I got the keys, this is my department, I'm going to do it. Then the other people just look back and say, well, I'm smarter than you. And you don't know what you're talking about, and you don't even know what you're doing. When I cross stuff like that, I just sit back and listen. I don't say anything. I just I let them talk, and I'm like, okay, if that's what you feel is going to work, I don't ever. Let me just say this. One thing I'm not gonna say hate, but dislike is I think it's funny because I'm a psychotherapist. People always think I'm analyzing. I don't. I turn it on when I'm getting paid. When I'm at church, I'm like, I'm not paying attention to what you got going on. Okay, now back to this. How do you recognize it? It's in the church. People have been called to the carpet for it forever. I don't think that's ever going to change in the church. I don't think it's ever going to change because people have gone after pastors in the church. You see what I'm saying? We were here before you. We built this. My father, my great, I'm fifth generation. All of that happens. And so, it's a way that I think a lot of things are based on the way people talk to each other and the way things are interpreted. A lot of when you're dealing with church has its history, and things get lost in translation. People get lost, things get lost in translation. If my kid went to this school, but your kid didn't go to school, if your kid got in trouble, or your kid, got this girl pregnant in the church, and all of that stuff weighs in on how we, move about the church. I think we're one of the biggest. We put people on pedestals in churches. I mean, we really, really do. I think if I were a pastor and there was dinner after church, I wouldn't want a head table. I wouldn't want a head table. I was like, hey, I'm gonna sit down with these folks this week. I'm gonna sit down with some of the folks. Why do I have to be at the head? You see what I'm saying? And so we're setting up. You got a pulpit, you have a stage that's above everybody else. So you're kind of looking down on the crowd. Now I understand why they do it, because it depends on how big the church is or whatever. But remember back in the day, a lot of times the pastor was right there on the floor with everybody else. So we kind of set that up. There should not be a head, and they call it the head table. And it's all nicely decorated, and the pastor got everything that's better than everybody else. And you're just like, you got classism in the church. Pastor, walk around, sit down, and come on, man, sit down over here with these people. I'm gonna sit at the table with the folks that, that kind of thing. We always say, if Jesus was here, where would he be? What would he be doing? What would he, he wouldn't have a head table, would he? He'd be like, I just want to sit down amongst the people.
I have to say, I'll give a shout out to some pastors. I do know of some pastors I can remember who were servant leaders, and that's all they took pleasure in, and serving, helping out. They didn't even like being put at the head and stuff. So, I think there's a lesson that can be learned. We talk about dysphoria conditions. How do we get there? Do we have that? Do we need help? Now we're talking micro. We're back micro, focusing on the individual states of how what happens with someone at their churches and how we're interacting. And as men, this is very important to us because biblically, I would say we're biblically based, most of us here, and biblically minded. I guess there's a hierarchy that has been set out biblically, but the way true hierarchy was played out is the way Christ left the message. This commandment I leave with you, that you love one another. Well, how do you love one another? It's through service. It's through kindness. It's consideration. It's through not making yourself higher than the other person. And you were talking about a point of people who are more educated than others. I love to interact with people that you don't even know, or they don't talk about their educational background as it relates to just and some of them, no, I don't want you to introduce me this way. Not saying just because you should be recognized too. If you went to school a long time, you got your credentials, great, praise the Lord. But when that goes before you, other than your true character, I think that's where Christ has an issue with us, because there's no more Greek, there's no Jew, Gentile, we're all evil. I think at the end, we're going to be judged. As someone said, we don't want to be naked before someone who knows us. Well, we're going to be naked in front of, on Judgment Day. Everything's going to be revealed. So I think we need to practice that now in how we get along, deal with each other. But since we're in this imperfect world, dysphoria, how do we deal with stress?
Well, how do we deal with it? Well, what a lot of people do is get involved in self-defeating behavior. Overeat, drink, sleep, sex. And what people have to do is they have to create a buffer between them and the stress. They have to be able to, when I see, bariatric patients, I'll ask them, what stresses you out and how do you deal with it?
So
and a lot of people,
Dr. Park, let me ask this question first before you go on. Is there anybody here on this chat or in this forum has not experienced stress or just stress-free? I want to see your hand. I don't think so. So what you're saying applies to all of us in the sense of handling and coping with stress.
Yeah, a lot of us don't know how. Again, now let's just stick with men, okay? And we kind of talked about this earlier. We don't know how because we're trained and socialized a certain way. You're a man, handle yourself like a man. You got a problem, you solve it. We don't sit back, we don't talk about it, we don't complain, we just go ahead and we do what we have to do to make it go away. Sometimes it's good, sometimes it's not. Some people sleep stress, try to sleep stress away. Some people try to medicate stress away. But you have to create a buffer between you and the stress. Get involved in, you see what I'm saying? Things like, okay, wait a minute, let me break this down. Now, a lot of stuff you're not going to know unless you really go to therapy or actually Google it, how to deal with stress. There are a myriad of things out there that you can do. Learning how to, regulate your emotions, learning how to be compassionate, learning about taking control of your mind, learning about being flexible, all these different things you can do. You see what I'm saying? To create a less stressful environment for yourself. We live in a high stress world. Okay. It's it's doubly that for us as Black men. Okay.
That's a question that Lynn kind of alluded to. He said, are these dysphorias very prevalent in the Black community?
Absolutely. They've always been prevalent in our community because we've always had to fight against the opposition. Okay, that being number one, ethnicity. So here's the thing. We have, the same issues as white folks, and sometimes to a greater degree, because we have what? Racism, economic disparity, prejudice, all these different things we're fighting against. And sometimes we're fighting at home against our own wives. Okay. The issue is that there's stigma and judgment when it comes to mental illness. Okay. What are some of the stigmas? And we talked about them earlier, but what are some of the stigmas? And it's anybody on here who wants to answer, just say it out. Don't put it in the chat. what are some of the stigmas that come along with, mental illnesses? I already said there is no diagnosis called crazy, but you don't want to be labeled crazy. You see what I'm saying? What do you think some other ones are?
Weak.
All right. It's a sign of weakness. You're embarrassed if you get help. You don't want folks knowing your business. I think, Hugh said something about that earlier. You don't want people knowing your business. That saying, what happens in Vegas stays in Vegas. Vegas thought they cornered the market on that. We've been saying that in black homes for years. Mother, they don't be talking about business out in the street. You know what I'm saying? Keep what we're going in this house, in this house. So there are things like that people, these are some of the stigmas. If you're a man, you told her what? Man up, be a man, be tough. It reminds me of that. It reminds me of that scene in The Godfather, where he goes to the Godfather, he's crying because he can't get a gig in Vegas. He's like, I just don't know what to do. Hey, what's wrong with you? Be a man. And he smacks him, be a man. And that's when he comes with, I'm gonna make him an offer he can't refuse, And so it's that. It's a sign of weakness, and we've always been told to what, as Black people, get over it. Get over it. That's what we've been talking about. And it's like, we can never get over it when it's constantly in our faces. How do we get over it when it's constantly in our faces? Okay. And here's the other thing, to answer your question, then our lack of knowledge about therapy. That's what holds us back from getting. You see what I'm saying? Our lack of knowledge about what's going to happen if I go. They're going to 1013 me to, a psychiatric hospital. They're going to transport me over to a psychiatric hospital or whatever. They're going to put me in a straitjacket. So you just sit back and you sit in it and you stew in that. And what happens? It gets worse and it gets worse and it gets worse to maybe possibly have a, mental health breakdown. And I am of the position that most of, if not all, our mental health issues are rooted in trauma.
Dan, I have a question here from YouTube, and it's quite interesting that your last word, doctor, is a question on YouTube. What are some actionable steps to take to heal from past traumas? I don't know if Pastor Dorset also mentioned some things on it a few weeks ago. Doctor, would you care to address that question? What are some of the actionable steps to take to heal from past traumas?
Okay, well, see, I have me talking about things that, I didn't think we were talking about, but I'm talking about narcissism and trauma. So here we go, okay? First of all, you got to define trauma. What is trauma? Trauma just means injury. Injury to what? Injury to the mind, the body, and the spirit. And it's not that trauma happens, but it happens over and over and over and over and over again, okay? And one of the interesting symptoms of trauma is the fear of it recurring. Okay, now, we're talking about injury to the mind, the body, and the spirit. What could that be? Loss of a loved one, loss of a limb, loss of a job, growing up in an impoverished area, molestation, rape, whatever. A lot of times, though, our day-to-day kind of runs parallel with trauma. Oh my God, how am I going to get these kids in school? How am I going to feed my children? We don't have a place to stay. They said they're coming to get my car tomorrow. They're going to turn the lights off. That can be traumatic for some people, okay? Now, here's the thing. Where's mine? And we did this before, but I'm going to do it again. Let me pull out my brain here, okay? I'm just going to give you half of my brain, okay? I don't know if you guys can see that. You see that? Now, yeah. Frontal, parietal, occipital, and these are all lobes, okay? And your temporal lobe in here, all right? So this is what happens. Now, trauma is this unusual experience that happens to someone wherein the nervous system and its capacity to process this experience is overwhelmed okay? And pieces of the experience are left unprocessed, frozen. They're left behind in the brain. So when the flow of energy hits those areas, you experience trauma symptoms, okay? Experience trauma symptoms. Let's talk about R. Kelly, okay? R. Kelly was molested by his sister and various and sundry other people, okay? Now,
For those of you
he
who
did,
don't know who R. Kelly is, he's a big artist that was in the R&B world.
big R&B artist, okay? And there was a thing done on him on Netflix about what he did with a lot of women, okay? And he had them, you know, kind of locked up or whatever in his home. R. Kelly was abused at a very early age, okay? So that's traumatic for him. And what happened? What did I say? When that happens, it's done. It's what? It's kind of like a shock to the system, like a arrested development. You kind of freeze. And so your decision making, okay, which is the frontal lobe, is kind of like, oh, what's happening? And then you end up making poor decisions or no decisions at all. But that's what happens. So as you grow older and mature, pieces of that traumatic incidents or those traumatic incidences like continual molestation and rape are in here unprocessed. He didn't go see a therapy. A lot of therapists, a lot of us don't go see a therapist. You see what I'm saying? So it's left unprocessed. A lot of us now behave in ways that we don't know why. People don't know why, because it's unprocessed trauma that's left behind in the brain. So with that being left behind in the brain, he begins to do what? Michael Jackson, R. Kelly, they talk to what? Little children, young girls. Why? Because that's where the arrested development stopped and started. It started for them at a very early age. So in other words, I don't have to talk to older women. Why? Because my money and my fame will get them. But my rap game or the way I talk to female, I can do that with younger girls because that's kind of where my mind is. Unprocessed, left behind in the brain. Now, a lot of times, and I'm gonna get to the healing part, a lot of times, what we find is that we have intergenerational trauma. Intergenerational trauma, what is that? Those are behavior patterns that have been left, that we pass on to our kids, and sometimes without us even knowing. Sometimes without us even knowing, okay? Generational or intergenerational trauma. Now, before you talk about that, you got to talk about this thing called secure attachment. What is secure attachment? Secure attachment is, it happens generally in the process of maternal bonding, okay? Where, let me see, what a newborn experiences this thing called a safe haven, okay? When they have that look that somebody's, loves them. They're making eye contact with you. They're special, or they know you're special to them. And then it's strengthened by what? The nurturing and the rubbing of hair and the way, brushing their hair, the way they talk to you, and the caressing of the body or whatever. You're getting that secure attachment. All right. So now, and when the touch is safe, okay. But here's the thing: in many cases, we don't get that. In many cases, we don't get that, and what happens is it results in an insecurity at a level, insecurity and trauma at a level that's very deep. And unless it's addressed, it's going to continue through our children. It's just going to keep getting passed down, okay? Results in a level of insecurity. What is insecurity? Insecurity is pretty much what? It's based out of myth and fear. Insecurity is based out of myth and fear. Let that marinate for a minute. So now, let's talk about when secure attachment doesn't happen. There's like 3 levels, okay? 3 levels. One is avoidant attachment. Avoidant attachment. Now, when I say these, think about yourself, think about someone you know, and somebody may say, well, I don't have any of those issues. Okay. Avoidant attachment. That's what happens when a child is left alone, okay, for an extended period of time. They're like always being left alone, or they get rejected when they reach out and try to make a connection. Like what? Maybe, remember back in the day, latchkey kids that came home, they were home by themselves because mom had to work, their dinner was in the stove, or they had to heat it up with a microwave. And then when mom comes home, they show up and say, hey, mom, look what I made for you for this. Yeah, okay, great. Put it on the refrigerator. I'm tired. I'll look at it later. Hey, dad, look what I got. Okay, yeah, that's good, man. You know, I just got in. Go show your mom. And so they do what? As an adult, they tend to be loners and what? Have a hard time making a connection. Have a hard time making a connection. That's avoidant attachment. Then you have ambivalent attachment. Ambivalent attachment is where you may have gotten good love from a parent, but it was inconsistent. It was inconsistent. Love you this week, but because I'm, because I have an addiction, I'm going on a binge and I'm taking the TV and I'm selling it, or I'm taking your video machine and I'm selling it, to get my habit mixed. Or it's like, yeah, I love you when you do good and I hate you when you do bad. Ambivalent. So now as an adult, what happened? These folk focus excessively on being betrayed or abandoned. So they have difficulty trusting a relationship because it's a fear that it may go away at any time. Okay? They go away at any time. Then you have disorganized attachment. Okay? And with disorganized attachment, what happens with that is when let me think. Disorganized attachment. Disorganized attachment is the parent has, some unresolved trauma that they hadn't resolved, or they're afraid because they don't know how to parent, or they're doing scary things in the relationship. Now, what happens in that instance is, as adults, these people focus primarily, they'll make a connection, but they will sabotage it, because there's some unforeseen or unexplained fear that arises. Oh, wait a minute. He didn't call me. He said he was going to call me. Okay, he's probably with someone else. I'm going to end this relationship. It's going to be over. What? What are you talking about? I didn't call because I was in a meeting. That type of thing. So you have avoidant attachment, ambivalent attachment, and disorganized attachment. Now, you can get attachment back. But someone asked about, how do you deal with trauma? There's several different things. There's brain spotting. There's, EFT tapping. There's somatic, experiencing, all these different things. I think I said brain spotting, and EMDR, eye movement desensitization. That's what it's called. EMDR, eye movement, something like that. I can't remember what it is.
So these are methods for us to.
Those are ways to deal with trauma. I'm not going to explain all those right now. Okay, but you can go ahead and Google them. And those are ways that people can deal with the trauma, you know, in their lives, seeking a therapist. Because guess what? If you live long enough, you're going to experience trauma. We don't get to go through life without experiencing trauma. Everybody's going to experience trauma. Questions? Do you want me to talk about how to get that secure attachment back, or?
Well, there's some more questions, Terry.
Oh, okay.
Yeah. Just before you go on, Doctor, the question is coming back. Based on what on the three attachment levels you just identified, all three seem to be unhealthy situations. Is there any healthy situation that you can describe where we potentially have these situations going on for us? I don't know if the question is making sense.
Right. Yeah. So remember what I said in the beginning. It's that secure attachment that happens where? In the maternal bonding. Okay. That's when a child is born. Now, you can't go back in the womb. You see what I'm saying? You know, it's getting biblical. You can't be born again, but you can be born again. Okay. And so, how do you get secure attachment back? That brings me to, you know, the topic. How do you get it back? How do you, you know, get around this? Okay. Let me pull up. I had to pull up my notes here because got so much stuff going in my head. Okay. Our parents cannot help the template they were given. You see what I'm saying?
Right. We can't. So you're saying you can't blame your parents for everything.
You can't blame your parents for everything. Okay. But here's the deal. Once they become more aware, there's a whole lot of resources out there. Okay. Opportunities like therapy to shift from that. Okay. Secure attachment can be learned later in life, even if you didn't get it in early childhood. Okay? Here are 4 ways to do it. Number 1, if you are married, it doesn't even have to be when you married. You could be like, you know, child to parent. That welcome home hug for about 20 to 30 seconds or whatever it takes you to co-regulate each other. Woo, baby, I'm home. I'm so glad to be home. Let me just hold you for a minute. Give me just a second. It was rough out there today. Okay. That's one way. Another way is while you're out, you guys are out, maybe at a church function, a party or something, and you spot each other across the room and you give them that look of, man, I really love you. You're just so amazing to me. That stuff, that really nourishes the bond. That really nourishes the bond. Okay. Here's another one. This one is big. Being protective of each other in public. Not speaking disparagingly about each other, you know, when you're together, and being a safe person to be around. You ever have cookouts and potlucks, and then you like those people coming like, oh my God, y'all invited them, you know they're gonna always fight. You know, or you having a barbecue, it's like, oh, here they come. Oh, Jesus. And then when they get it, the woman goes to the kitchen, the man goes out by the grill, and they're talking about each other. Okay. You have to be a safe person to be around. Okay. And here's one that's really big. Here's one that's really big. Okay. Is playing. Playing. Okay. Playing is real huge. Why? Because we work too much.
Wow.
We work too much. Okay. We don't play enough in our society. And play brings us back to what? Secure attachment. Remember you were a kid and you out there playing? You don't have anything to worry. You don't worry about a thing. Okay. And that play brings us back to secure attachment, and it refreshes our spirit and connects us to what we really like to do, which is what? Healing in itself. You got to play more. Get out there, run around, kick the ball.
Yes.
Throw the ball, do different things. that. You see what I'm saying? Now, here's the other thing. This is what some people won't realize. A lot of times when children are having difficult periods at a time in their lives, it's because they are triggering a dormant wound that has not yet been healed in the parent. Oh, it hadn't been resolved. And the more we heal ourselves, the more we heal our families. I give you an example. This young lady came to see me, and she was talking about her daughter who was 9. And her daughter was struggling and having problems or whatever the case may be. And I remember in previous sessions, she told me that she had found out that her father was not dead at 9 years old, like her mother and grandmother told her. And so when she found out, it caused a lot of issues. And, now I'm dealing with a mom who lied to me, and my dad did want to be a part of my life, but and when she started telling me about her daughter, I just listened. And I said, tell me what significant happened in your life at 9 years old again. And she said, whoa, that's when I found out who my dad was. And so and she stopped in mid-sentence and she started crying. Because that was an unresolved issue in her that stayed with her, and she passed through her womb through her child. Trauma changes our DNA. It changes the DNA. Imagine this. Watching your mom be strung up and having her belly cut open and watching your little brother fall out. Imagine your sister being out there raped in a cotton field. Imagine your dad being tied between 2 horses and one going east and one going south. Imagine your brother being placed in a barrel with spikes and nails shut and rolled down a hill. That's trauma. It changes the DNA, and that passes on through us. Remember what I said, intergenerational trauma. We are born with these issues.
So then we should not think that no one has any issues or everybody's just good.
We all need therapy. Now, here's the thing, though. Let me go back to this. Let me go back to this whole So here's the thing. Let me just say this: if you just because you have good secure attachment, it doesn't mean that what? You won't experience trauma. But people who have good secure attachment, they're more resilient. They bounce back quicker than those who don't, based on the way their brain and nervous system is set up and structured. I'll give you an example. This is a kid with secure attachment. Call home from school. Hey, hey, Ma, how you doing? Hey, Dan, how you doing? Is everything all right? I know you had that test. How did you do? Well, I don't think I did so good. Oh, you didn't? Well, what happened? I know you were studying so hard for it. Yeah, but Mom, it was real hard. And, I did study. And, oh, I'm so well. Is there just a midterm and a final? Can you retake it? Can you talk to the professor? Can you do whatever? Well, yeah, I'm thinking about that. But I just got to dig down deeper, Oh, baby, I'm sorry. Hey, your dad just walked in. Hey, hey, speak to Dan. He's on the phone. Whatever. How did he do on his test? Well, I'll let you tell me he doesn't think he did so good. Hey, son, how's it going? Hey, Junior. Hey, Dad, how you doing? Oh, I don't think I did so. Oh, man. I know you were studying hard for that thing. Look, when I was in school, I failed a ton of tests. Don't even worry about it, man. You'll be fine. You just get them on the next go round or whatever the case may be. Hey, listen, me and your mom is coming up this weekend to surprise you anyway. We're making your favorite brownie. Oh, you guys were? Yeah, we'll be there this weekend. Don't worry about it. We'll talk about it. Everything will be fine. That person is going to do what? They're going to bounce back. They're going to be better on the next test or whatever. Now, Here's the family that doesn't have secure attachment. Hello? Hey, what you doing, Mom? Same thing I usually do around this time when you was here, cooking for your dad. Oh, okay. Well, I was just calling you to tell you I had my test today. Well, how you do? Well, I don't think I did so good. What you mean you ain't do so good? Every time I call, you said you were studying. So what, you was lying? Well, no, I wasn't. I was studying. It was just a difficult test. That's why they call it college. It's difficult. That's what you're supposed to do. See, I know you just up there walking around, you know, socializing or whatever. Ain't nobody got money for you to socialize. If you don't want to study, then you probably need to come home. Who that on the phone? This Junior. He up here failing into school. He ain't even passed that test today. Now, notice he never said he didn't pass. He said he didn't do well. Dad, get on the phone. Hey, boy, what you talking about? You done passed that test. Dad, I didn't say I passed. Listen, let me tell you something. Ain't nobody got no money for you to be walking around up there. Now, I told you before you left, we ain't had no money for you, but you had to go. So now that you up there, you need to put your head and get old Southern folk. You need to get your lesson. You up to that schoolhouse playing around. You know, now if you feel that way, you come home and you get you a job or you go to this community college, but ain't nobody got time. All right, Dad, I gotta go. Shoot, you on the phone wasting time now. You should be studying. All right, Dad, I'll talk to y'all later. Which kids don't bounce back? You see what I'm saying? Secure attachment. You can get it back. Okay. Any other questions?
We're caught up in that acting routine. I saw it in my head.
Doctor, there's another question here. The cost of therapy can be prohibitive to the average person.
Uh-huh.
And the emphasis has been this evening on getting therapy.
Mm-hmm.
How do you suggest that maybe for the average guy on this call, the cost of therapy is manageable? But what about those people who are the average person in church for who the cost of therapy is prohibitive? How would they go about addressing that issue of costs?
Okay, that's a good question. There are a lot of therapists out there that have a sliding scale. Okay, have a sliding fee scale. Now, notice I said fee, not free. A lot of people mix those two up, okay? But there are some therapists that will see someone because they figure, you know what, this person needs help and they don't have it. There's just about anybody can get Obamacare and they come in and they can go that way, or you can say, okay, I tell you what can you pay? A lot of therapists say, what can you pay? Well, I could just do $5. Some therapists will take $5 a session to help this individual out. So they have sliding fee scales. Issue is if you want help, you'll get it. And money won't stop you. When you want something, you're going to get it. And money's not going to be an object for you if you really want it. And so when it comes to that, they can easily call if they don't have it, insurance. They don't have. People think therapy is really expensive. It's really not. It's really not. If you have insurance, it's really not. If you don't have insurance, then it probably would be, because guess what? If you don't have any money, everything's expensive. Okay, so there's a way to go online, find out. Go to the local community service boards in your community. They get free services. Go in, they bring the children, they bring the whole family comes in, and there's someone in there who's a social worker who is seeing these people, and the state is paying them. You see what I'm saying? So you go to the community service boards and seek out the help. That's would be the first place I would start. And so you can start going there for therapy, because those social workers and licensed people are paid by the state. They're not paid by individuals. Right. I agree here. Edward says it's more expensive in the long run not to have the therapy. And it is.
Yes.
Um,
We have some really interesting comments in the chat, but it's more expensive in the long run to not have therapy. We'd rather pray, do drugs or booze or sex.
yeah, because remember what I said before? People do what? They'll either, Dan asked a question about dealing with stress. So we'll do what? I'm gonna sex it away, I'm gonna drink it away, I'm gonna snort it away, I'm gonna shoot it up away, whatever the case may be. I'm gonna Netflix it away, just sit here and watch, movies or whatever the case may be. Here's the weird thing. This is what we do. A lot of times, it's just like when you have a breakup with your girl, you go and do what?
Makeup.
You do what? You play all the sad music. It's like, why are you playing sad music? It's like, let me play something that's gonna make me happy. And just like it is when we're stressed out or depressed, we may watch a movie. Like if we're mad, you may go watch a movie that's full of action and killing people or whatever. Like, yeah, that's what I want to do. So you have to be careful of what you take in here and in here during those times. What is it? The eyes are the window to the soul. Yep.
Mm-hmm. Mm-hmm. And Doctor, just want to thank you. From YouTube, the responses, your answer about how to get secure attachment was insightful. Thanks.
Okay. You're welcome.
They were saying that you got so much information that they may want another session with you. I call it a session.
Well, if you call it a session, then I need to get everybody on here insurance information.
Dan, why are you trying to get us in trouble now, huh? Well, listen, Doctor, it's almost 4:30, and we want to be respectful of your time. Dan, you want to close off, Dan?
Sure. Someone asked where you located, Dr. Parks.
I am in the metro Atlanta area in Georgia.
Your information,
my website, which is www.anabh.org, which is a new approach behavioral health.org. You can go on there. And
type that in the chat.
Yes, we'll do it another way. Dan, we'll put that in the chat. So that, and if you have a telephone number, Doctor, if you don't mind sharing a telephone number with us on the chat. Dan, you want to put it in the chat here?
Somebody already typed it in. Okay.
Okay.
And I'm going to type in my phone number now.
Okay, good. And Dan, you also have Doctor's information. We can get it on, put it on the WhatsApp chat, right?
Yes.
Yeah.
Please, thank you.
So this is
okay, Dan. You want to close off, Dan?
Sure. This has been very informative. Want to thank our host, Marcel Sutherland, who shared this platform with us on Friends Talking. We have a great friend in Dr. Parks, and he definitely can talk, but he's just not saying that he has a lot of information to unpack. I'm glad you had that brain display. We are visual. We learn that way. There's a lot of information. I'm glad you're recording this because you can go back. He can share it. Marcel will share it again, unpack it. I think one of my main takeaways is that we all need therapy at some point in time. Therapy in Jesus, you can do that. You can have that. And we all can start, or we should talk to our pastors about having a mental health ministry. I like that. Mental health ministry. Separate from the health ministry, mental health ministry, because that's very needed. And it teaches us new methods in how to deal with people who have their social and psychological issues. And it was very informative. I'm glad everybody from all around the world was on this platform, opening this up. And at this time, is there anyone special you'd like to ask to pray?
Well, Dr. Ray, before you go, do you have any last comment you'd like to leave with us? Any last bit of advice that you'd like to share with us before you go?
Sure. I mean, all I will say is this: we all need therapy, and you can have a therapist and Jesus at the same time. Okay, believe that they work. hand in hand. We work hand in hand. You know, you can see a if you want, there are therapists out there who are Christian based. They're faith based therapists. If that's what you want, you can find those. There's just so many therapists out there. I am part of the Georgia Therapist Network, which is conglomerate of just therapists everywhere, mostly in Georgia. And so if someone is telling you, hey, I think you may, need some help or whatever, take heed to that. Go and get help. Your mental health is more important than anything. You'll go out, you'll wash your car, you'll change the oil, you'll flip the tires and everything, but you won't go see anybody about what's going on in your head. That's a problem. So get into therapy, even if you think there's nothing wrong with you. Get into therapy. You don't have to have anything wrong with you. A lot of times it's just good to talk to somebody. I was just having, just want to talk about some things. The next thing you know, you're sitting there telling the person your whole life story.
Mental health tune-up. We get a tune-up for our car.
Absolutely.
Have a tune-up for ourselves.
Dan, Dr. Parks, on behalf of Friends Talking, I'd like to thank you, gentlemen, for Dan so expertly hosting our session this evening. And Dr. Parks, certainly the invitation is extended to come back again to unpack some of those untold stories and therapies that you can share with us. We really were, as I always say on this forum, our minds have been stretched by the ideas that you have shared with us today. And we cannot return to the original dimension that we were before we began earlier today.
Well, thank you for having me.
Thanks, sir. And we look
check
forward
us out on the Quad Squad too.
I'm sorry?
I was telling everybody to check us out on the Quad Squad.
No, you got to pay for that advertising here.
Oh, okay. I thought I was a part of the Friends Talking.
No, that's messing with you. Next week we're going to be having a friend of Dan, Sean.
Oh my goodness.
Sean will be with us, attorney Sean. He'll be our host for next week. I don't know what his topic is going to be, but you will be informed during the course of the week as to what his topic will be next week. Again, thank you very much. And just before we go, I'm going to invite, seeing that Dr. Hugh was so actively involved in the conversation today, I'm going to invite him to pray for us to close, please.
Why you gotta do that, man? I mean,
you were on fire, man.
Let me find a good spot. Hold on. All right, gentlemen. It was Doc. Thank you, man. This was really good. I've been in therapy for years, man. I stand strongly behind people getting therapy.
Good deal.
All right, guys, let's pray. Father God, we just want to thank you for allowing us to come together today, Father, to consider a different perspective. Yes, Father, we know we come to you with all our needs. Yes, Father, we have realized that we need a human element. And so, Father, we're exercising wisdom. And so, Father, we talk about first to you, Father, and to the human factor here. And so, Father, we just thank you. Thank you for the information that we have gained today. May we apply it to our lives. May we continue to seek you in faith. May we help others. May we be a listening ear even sometimes, Father. Some of us may not get to therapy, but just the ear of a brother would save us from our suicidal thoughts sometimes. And so, Father, I pray for each man here and their family, Father, that you will indeed draw close to them and they draw close to you. I thank you for the good doctor, and may you continue to bless his practice and the good work. And we just thank you and meet again next week. We ask your guidance on us in Jesus' name. Amen.
Amen. Amen. And Dr. Ray, has he left us? Oh, he has left us. All right, gentlemen, have a good rest of the Sabbath afternoon. Horace, it's almost midnight for you there in the UK. Have a good sleep, and we'll catch up next week. God bless you all.
Blessings to all.
All right, Master.
Hey,
Take care, man.
gentlemen. Blessings.
This was good stuff.
Good man. Good.